जब से हमारा पेशेंट आईसीयू से डिस्चार्ज होके आया है, वो तो बिल्कुल बदल ही गए हैं। ना वो हमसे कुछ बात करते हैं, ना किसी एक्टिविटी में पार्टिसिपेट करते हैं, थोड़ा बहुत कुछ खाते हैं, सारे टाइम अकेले-अकेले से रहते हैं। Dr. Ashish, can you help us understand what is going on with our patient? Surviving the ICU stay is not the end of the story. It is the beginning of a new phase of recovery. But unfortunately, many families and patients don't understand what next is coming. Many people survive the ICU, they get discharged from the ICU, but recovery does not always end at the discharge. So, today we'll talk about a syndrome which is known as post intensive care syndrome or PICS. It commonly affects the patients who had severe illness, who had a long ICU stay, who were on mechanical ventilation, or had ICU delirium problems. So, what is PICS? PICS means problems patients face after leaving the ICU in the form of weakness, mental instability, memory issues, feeling anxious, or feeling very low. In technical terms, PICS refers to new or worsening physical, cognitive, or psychological impairments after critical care illness or discharge from a critical care illness setup or ICU. So, how common is PICS? Yes, it is very common. About 50 to 80% of the patients who get discharged from an ICU after severe illness are affected in one form or the other. Or, in other words, 1 out of 2 patients would have some of these symptoms. So, what kind of physical problems one could face? So, patients generally feel very weak after the ICU discharge. Even simple activities like going to the toilet becomes very difficult for them. They feel tired all the time. There's restlessness, there's shortness of breath is a common complaint. What about the memory or thinking or the cognitive problems? Forgetfulness with impaired memory. They are unable to focus on simple activities. There is attention deficit and there is mental slowness, which is generally seen. What kind of mental health problems could be there? So there's a lot of anxiety post discharge. Some patients have depression. There is a feeling of fear, as if there's some kind of a post traumatic stress disorder. So the next question is, what can a patient or his family do for his early recovery? It is important to maintain a good routine for the patient. Graded physical activity, like starting with small walks and going into yoga and other activities, always help. Eat healthy and ensure good high protein diet. Maintaining a daily routine is very important, as I have said. Well, what is the timeline for the recovery? It is generally seen that all the initial physical impairment goes away in the first 3 months, while the other features which are related to the cognitive behavior and the psychological or the mental health of the patient takes a little longer, say about 6 to 12 months. It has been seen in research that about 25% or more patients will require some kind of help for the first 1 year after the discharge from the ICU. And can the family help? Yes. Family is the most important factor. A supportive, caring family. The family that encourages activity, provides with good nutrition, adequate medication, along with a family which listens without judging, always helps. Are there points which we should worry about? Yes. If you feel that patient is going into severe depression or is having panic attacks, feeling severely breathlessness, complaining of chest pains, or has severe confusion, it is always necessary to consult a doctor. So, what is the final message? Well, recovery from the ICU is a journey. It takes time. One has to be patient. Coming out of the ICU is just the part of the process. The process is longer. Thank you.